Welcome to another episode of the Pause and Effect podcast, the ultimate destination for pet enthusiasts seeking expert insights. I'm your host, Dr. Cara, and today we have a special focus on small animal rehabilitation. Joining us is Paige from Equine Librium, a seasoned expert in post-operative physiotherapy for our furry friends. Let's get ready for an informative session that goes beyond the surface of addressing questions pet owners may have about their companions post-procedure recovery. Welcome, Paige. Welcome to the podcast. We have had your colleague here, Lee, before. You are from Equine Librium.
Yeah.
Not to be fooled by the equine at the start. This is physiotherapy. Small, large, and everything in between.
Exotics,
So we were talking. Tell me, what have you treated?
So we had really interesting while we were studying. Obviously, we're down in Plettenberg Bay, and there is quite a few wildlife rescue places. And there was a little penguin that they suspected got attacked by a seal, and its flipper wasn't working super well.
Oh, shame.
So we just did a little bit of rehab, see if we can get that nerve working a little bit better. I know the girls there have also done a couple of the cheetahs at the Taniqua Wildlife Rehab.
Wow.
Cows, lambs.
Lovely.
Everything.
But you have set up, so part of the reason why I have the privilege of talking to you is because you've set up a phenomenal clinic here in KZN. But you guys are nationwide, aren't you?
Yeah.
So tell us a little bit about Equine Librium and tell us about your facility here in KZN.
Super. So we're really, really lucky. We are pretty much countrywide. We've got girls, there's 4 of us here in KZN, 3 full-time in the clinic and then 1 part-time. We've got, I think now 3 or 4 girls up in Gauteng, 2 in Joburg, 2 in Pretoria, and then PE, Plet, Cape Town.
Sure.
So pretty much wherever you
distributed, so access to lots of people.
It's also quite nice, like we have a couple of clients that they go on holiday down to the Cape and they're taking their dog with. We just say, this is the patient, this is what we normally do with them, how we treat, and it's nice to have that
good
continuity.
Relationship between
I mean, we're always in contact with each other and asking questions for difficult cases. So
good collaboration.
Yeah, it's just nice to have that team behind you. It makes a really big difference. So we're very lucky here. We've got a nice strong team, quite a nice mix between the equine, canine, smallie side of things, but obviously only have this small animal clinic because we've got an underwater treadmill.
Yay.
So it makes it really nice to have that backing, and there's always someone around to provide service if someone's fully booked or on holiday or on leave.
So explain to the listeners who don't fully understand. Obviously, I had the privilege of talking to Lee before. We discussed a lot of the modalities that you use. So a lot of like your underwater treadmill and laser and EMS. Am I saying it correctly?
Yeah.
Yes. See, I've learned something. You have a phenomenal setup where you're based. And you're doing a lot of really good work for a broad range of conditions. You have a particular interest in post-op, don't you?
Yeah, I like things that get better quickly and graduate.
Yes. So, I mean, from a vet's perspective, anything, as far as I'm concerned, we made mention of this before, anything that has been recumbent, has been hospitalized, it will benefit from physiotherapy.
I mean, if you look at sort of the human side of things nowadays, if you go into hospital, you get physio pretty much part of the package. And so I think we're really starting to catch up veterinary side of things with that. Just basic things like disuse atrophy, bed sores, things like that, wound healing, infections and stuff like that. We like scar tissue sometimes, we don't like scar tissue other times, so it makes a big difference the earlier we can sort of intervene, especially in those post-op cases, to try and normalize function as much as possible. But I mean, we have a couple of dogs, especially like our cruciate dogs that, we understand they are predisposed to doing both sides generally. We can prehab the next leg beforehand, so we make sure they're going into that as strong as possible.
Okay, so let's unpack that a bit further. So because some listeners may not understand or have got new puppies and don't understand the whole. So cruciate ligament rupture is obviously a common thing that we see within a practice.
Unfortunately.
It's very unfortunate. And there are things that you can do and things that you try and mitigate risk in terms of managing weight, and we'll talk about that hopefully in our podcast today. But you're saying that when you have a case that has had cruciate repair, not only are you working on managing the recovery period for that limb, you are also managing the risk of the rupture in the other, which is, I mean, the awareness may not have been there, but that's even, I hadn't even thought down that route.
Yeah, it's just, we understand, especially Daxi's predisposed to discs. The stronger we can get them, the stronger we can keep them, the thinner we can keep them. And also just owner education, making sure they aren't flying off the couch every 2 or 3 times a day, and it makes a really big difference if we can just get a little bit of prevention rather than relying on cure.
Absolutely.
So we'll obviously try and get as much symmetry because we like evenness, and you've got pathology in the limb, you understand that there is going to be a likelihood that the other legs are going to have pathology too, and just inherently they do start to overuse that side, which also ups your risk factor. And we like to be a little bit of an early warning system. So, we can say we're not gaining muscle like we should, or we've got reactivity and pain, maybe pop across to the vet. And, the chances are we maybe get lucky and it's only a partial rupture instead of a complete rupture, or the sort of degeneration in the joint is that much earlier.
And you're talking about things that often us as vets don't necessarily have the time or availability for. So,
exactly.
I mean, you've got a really great way of going about advising your clients in terms of from a nutritional perspective and the importance of good nutrition in post-op or in like I say, weight control.
Yeah.
And explaining to people how they can have the best environment that they're in a position to offer 100%. For their pets. So it's quite a holistic approach.
That's the thing. It's definitely just... I'm pretty sure Lee mentioned it's part of a team. That's the big thing, is we all support each other. And so the more we can support each other, the better we can get the outcomes for the animal, because, at the end of the day, that's what we're doing it for. We're doing it for the animal and for their owners, so that they can enjoy as long as they can with their pets.
Yep, we all want as much time with our pets, don't we?
Yeah, so it's just... the more we can work together and the more we can give that holistic approach and be able to give the time, that the vets unfortunately don't have to explain things and allow the owners to really get that understanding, it makes a big difference.
And I probably another add-on to that, there's sometimes we are very familiar with terminology that we use. I mean, obviously some vets who are really good at breaking things down, and I applaud them. We're like this, they really are good at explaining things. But when we've graduated, we've gone through all the terminology and things, and sometimes you find yourself using words or terms or explaining things that a pet owner may really struggle with. So not only do you explain things potentially again, but you can also support and then clarify a lot of the misconceptions.
And I don't know, I just know from my own perspective, before I did this, it can be a little bit intimidating being in with a vet, because they got time to talk to you for 2 seconds, and you don't want to make it feel like they're having to sit and explain everything and really go to that layman's perspective. So they sit with us for a lot longer, because our sessions are that much longer, and so there is time to really get in depth and really explain and give a full picture of why we're doing and what we're doing, and it just allows for better understanding, I think, which is what we want. And we also just tend to see the animal that much more often. Most vets see the dog once a year for vaccinations or if it's got an injury. We are pretty much either weekly, monthly. So it allows us to be that much quicker with intervening and with things that, the vet might be 6 months late because that was when the dog was brought, and the owner didn't understand necessarily that, the earlier we got it in,
absolutely,
the better chance we have of getting a recovery.
So, I mean, we're hoping that by raising awareness and by talking about the benefits of veterinary physiotherapy. And I also wanted you just to provide some clarification in a minute, that you've gone through very extensive training. This isn't just giving an animal a massage.
Yeah.
But the importance here is the ability to act early and to help with the recovery process in terms of mitigating any risks, but also just putting in and instituting things that us as vets don't have access to.
Yeah. So I think that's unfortunately where we've battled a long time, is that the vets are really good, like, they can cut things open and do their surgery, and they can give injections and give medication. But unfortunately, that doesn't always work for every case. And so it's really nice to have the ability to really adjust, the home environment of the dog and adjust how the dog is being handled on a daily basis, so that the medication can do what it needs to do and help with the pain and inflammation and things like that. I think it's just a very, very different approach. And you see it in humans, how we have improved outcomes with, the whole team approaching things.
Absolutely.
And so why don't we do it for our animals?
No, I think it's definitely, hopefully, moving forward in terms of that. Before we dive back into our conversation with Paige, let's shine a spotlight on the essential aspect of your dog's dietary needs. Today, I want to share my experience with UltraPet's special diet, Hypo-Allergenic dog food. Now, I've recommended this to many clients for their pets, and the results have been consistently impressive. This specialized dog food is crafted specifically for adult dogs with food allergies. It contains a novel protein source, duck, and a unique carbohydrate source, potato. Grain and gluten-free, this formula is designed to minimize the likelihood of allergies. It's crucial to note that this food should be fed exclusively. The idea is that pets are less likely to mount an immune response or show sensitivity when introduced to a novel protein and carbohydrate source, like duck and potato. For optimal results, a diet trial of 8 weeks is advised. During this period, it is crucial to exclusively feed your dog UltraPet's hypoallergenic dog food to accurately assess the impact on their well-being. Additionally, addressing other factors contributing to skin issues is essential. Managing ticks and fleas, taking a holistic approach to your pet's well-being, and understanding their unique needs plays key roles in supporting skin health. If you want to delve deeper into addressing skin issues, consider listening to our previous podcast episode on itchy skin for more insights. In conclusion, if your dog faces food allergies or skin sensitivities, UltraPet's special diet hypoallergenic food is a thoughtful choice. Many of my clients have seen great results. Give it a try during the recommended diet trial period and observe the positive impact on your dog's health. Now, back to our enlightening conversation with Paige from Equine Librium. So let's use a bit of a case example. Rather than the sick pet, let's use a pet that has had some surgery. Let's use our cruciate repair. What time frame? So we're obviously talking they have been, if they've had the privilege of seeing you before, that's great. But if they haven't, at what point should vets or owners be discussing the case with you? How soon do you want to see them?
Ideally, the day of.
The day of.
We don't get that very often, unfortunately.
So they've just come out of theatre, they've recovered. Yeah. At that point, it's actually beneficial to contact and have some.
Yeah, exactly. And I mean, obviously, for most of these cases, you have the surgery scheduled. So if we can get the patient charts prior to the surgery, that's even better, because we can at least work up a plan, and then you can chat to the surgeon and say, any complications, did the joint look how you thought it was going to once you got in there? Because that's always a big thing. Just because you see something, diagnostically doesn't mean clinically it's actually going to be like that. And then once they've, finished suturing everything and put the dog back to recover, they can say 100% was a super surgery, or actually meniscus involvement, so we're going to have to adjust approach and things like that. And then, unfortunately, I think we are a little bit late to get involved at the moment. It is very much up to the surgeon. We understand they put a lot of time and work into that animal when they've done an operation on it, so they don't want, they want to control risk as much as possible. But it is building that relationship and building the trust that, we do have a lot of understanding, and we're educated with the vets.
So let's take a break in our case discussion and let's go back to it. Let's talk about your qualification, because I think it's really important. I know that Lee did make mention of it, but you have done a degree. This is not a course. It's not a 2-week course. And
no,
you do. I mean, from the way in which you're communicating things, I think the listeners can appreciate. You know what you're talking about. There's no claims that you guys, want to be doing vet work. And there's no undermining, and there's a respectful sort of relationship between you and the vets. But there's so much that you can offer, and there's so much that you know and do that we can't.
Yeah, so it's now, luckily, a 4-year BSc. So full-time, unfortunately, it's not a course that you can do online just because of the practical aspect. It's changed quite a bit from when we were there, and we are now completely registered with Council of Higher Education. All of us are registered with the Vet Council.
South African Vet Council,
we're regulated. We have to do CPD so that we're staying, on top of everything and making
CPD,
sure.
just for the listeners, so they understand.
Continuous professional development.
Absolutely.
So
and that means you have to keep up with the new technologies, the new thoughts, the new
all the research that's coming out and things like that. Because, especially because we are so new, there is changes daily.
A lot to learn.
It's just. It's ironic, I suppose, because a lot of the things we use were tested on animals before they got used on humans, and now we're going back to testing them on animals to see how they, work. Yeah, they work for us in these specific situations. So, it's a pretty intensive course or degree now. We do a lot of the sort of anatomy, and it's sort of split into veterinary subjects and our more clinical subjects. So we do all of our anatomy and physiology, exercise physiology, pathophysiology, and we work quite a lot with the vets. Luckily, we have actual qualified vets as lecturers for quite a few of our subjects. So we understand sort of how to talk to them and what their perspective is, and how we can give our perspective to give a bit of a broader picture for them. Because I think that's really important, is we approach things very differently, and you see things differently because of that. And it's really exciting because, we do 4 years of pretty much movement. We look at biomechanics, we look at how, the body functions. Unfortunately for the vets, they have, a lot to cover, and they have to do the medical side of things. So we are very lucky that we get to do that so in depth. And I think that's why we do have that different perspective, because it allows us to focus on, how we can modify and how we can improve things. And the vets just, unfortunately, they have to sort of learn that afterwards, I think. Yeah. There's just not enough time when they're going through the massive amounts of information. And
even if the intention's there's not always the time or the aftercare that's available for our patients.
Yeah, and I think also, especially in humans, we go to the GP for specific things. If you've got a problem, you go to a sports doctor, for movement and stuff like that. Our vets tend to have to just cover all bases. So it's just a monumental amount of information, and you can't keep up with it because it's just impossible unless you specialize. And that's why we have specialists, and that's why we're supposed to be supportive, to give the vet, our perspective, so that they can say, okay, that makes sense. Yeah. And all of their knowledge and wisdom that they've gained over the years can sort of weed out problems and hopefully come up with the best solution.
Definitely. So let's go back to our case. So I didn't realize I could phone you while the patient was in my care, but I've just discharged them, and I don't want it to be a situation where I'm phoning you when things are not maybe going to plan. I actually want to be proactive about this case.
Ideally.
Okay, so I'm going to picture this. I'm going to put this scenario in front of you. I have my post-cruciate dog. no complications, nothing abnormal, maybe a little bit chunky because they always are. What are the steps that you take? Take us through a typical, just a summarized version of obviously there's a wound that needs to heal.
Sure.
What are the steps early on and how do things progress for a case like this? Just to give a bit of insight to people who don't understand.
So generally we'll like to get the chart for each patient so we sort of know exactly what's going on, how long, history-wise they've been dealing with this problem, because sometimes it is that they've, had an on-off lameness that's sort of been niggling and then ruptured the cruciate completely and now have become a candidate for surgery. Always nice to check in with the surgeon. They'll generally give you information that's not always written down, so it's just nice to also open that line of communication so that they understand that you are going to be seeing the animal, especially if the owner's the one that's approached you and not the surgeon. And then we'll do a general evaluation. So
what are you looking at?
Movement. So, obviously post-op, a lot of the time they're in quite a bit of pain. There's a lot of trauma that's gone into that area, and so we want to see if they are ahead or behind what they should be.
As in the time frame that you would anticipate.
Yeah. So we want to see how much weight bearing, if they are weight bearing on the limb, if they have massive swelling, anything that sort of deviates from our ideal picture.
Okay.
And
so you're looking for things, like you say, having some of the history in terms of how is this been a progressive condition or has this been just a cruciate rupture because they were throwing a ball and the dog was which we spoke about before. Are we dealing with disuse atrophy in terms of are you having to then go from the point of managing building muscle, or are you having to just worry about wound repair? So your approach is obviously based on each situation, but my interest in particular is you have a wound. Now you can't then, because I'm picturing this from a vet's perspective, it can't go into your underwater treadmill.
No.
So take me through, what are you doing? Are you using what modalities, for example?
Okay. Yeah. So obviously once we've evaluated and we sort of picked 2 or 3 areas that we want to target. So obviously wound healing is going to be really high up on that list. We want a nice clean wound. If there's staples involved, you always have to consider that because metal heats. So we'll generally use something like the laser in the vicinity, because if there's metal, you really don't want those staples being heated by the laser because it does. We use a class 4 laser, so it does create heat.
Okay.
We also obviously want to look for signs of infection and things like that, so that we can refer back to the vet if need be. If it's a sort of ideal wound and we're looking good, then we'll just try to do a little bit of passive range of motion, so getting the joint going through all of its sort of normal range.
So talk to me, is that again about the muscles, or is that about improving blood flow from a physiological point of view? Are you or is it both?
Both,
okay.
Yeah, so we want to make sure that obviously they're not going to want to use the leg normally, so they're not necessarily going to flex it how they should or extend it how they should. So we want to make sure that they sort of understand that they can go into those ranges a little bit. And
memory that.
Yeah, because you do get a degree of distrust because they go, oh, well, the leg was sore last time I put it in that position, so let's not do it again. And because you're not getting the use that you should, the blood flow is not going into the muscles like it should, which means you're getting waste product buildup and things like that. So the more we can improve blood circulation, the better. It's always our sort of primary goal, because the more blood flow you can get to an area, the better.
Okay. Which is the laser is beneficial for that.
The laser is amazing. We love the laser. Yeah, it's great for blood flow, great for improving blood vessel formation. It's super for decreasing inflammatory mediators, really nice for improving sort of lymph drainage. It's got a quite a long list of sort of physiological effects that you can sort of target towards, but generally it's biostimulation, so it just gets optimal function from the cells.
Amazing.
Which, when we want healing, is what we want. And then you can add things like the TENS, which is transcutaneous electrical nerve stimulation, and that's targeted for pain. So we want to decrease discomfort in the area, obviously, which allows us to work a little bit deeper if we are going to add manual therapy in. So a little bit of massage, fascia work, again with passive range of motion, stretching to normalize the tone of the muscles.
Okay. Because some of these muscles contract.
Yeah, exactly.
Okay.
So, you get that tightness because they're guarded, because they don't want to use the leg how they should.
Mm-hmm.
So you want to sort of allow them to understand that they can use it again and encourage it. And then we'll add things like pulse electromagnetic field. The beamer is a really nice one for that. And our Cape Town clinic, I think, has some really cool loops that have just come out.
Yeah.
And they're, super, super for treating pain, and just very exciting new modality.
Yes. So like you're saying, you're learning all the time in terms of the availability of some of the
exactly
tools that are coming up.
Yeah, and then we also have things like shockwave. That
Sounds
are generally,
severe.
Yeah, it is. It's a scary word.
Yeah, do people get put off by some of the...
Yeah, I think so. It's a difficult one because it sounds quite hectic, and it is. It's a pretty intense modality. We do tend to introduce it slightly later in the sort of healing process, but really, really useful as well. And it's quite loud, so some of the dogs do battle with it a little bit, but I find once they have understanding, they're super. Like I actually have had a patient that it took me a full hour to do about 1,000 shocks. And I was like, oh my goodness, I'm going to have to chat to the owner about chatting to the vet about getting, a sedative or something like that, just to allow them to understand that it isn't as bad. We came back the next session. It was like she'd had time to think about it. And she sat perfectly still. Yeah, and I got over 2,000 shocks in less than 15 minutes.
They're very forgiving.
They are. That's the best part about animals. But yeah, it's just, we obviously approach everything case by case, but if you've got an ideal situation, you want to try and get healing going as fast as possible, blood flow as fast as possible. And
they've invested a lot in the procedure itself.
Exactly.
So you want everything to go smoothly, and you want recovery, because I find often with patients you can give, and I'll come back to the owners following instructions, but you can give advice and whatnot, but you don't have the aftercare always. Our nurses are phenomenal. I mean, I can certainly say that our team within my practice, they really are good, and we've come a long way in terms of understanding the benefit of closer engagement and better communication with our owners, and giving them more responsibility. So the more you're talking about it, the more people understand the benefit of your advice or your suggestions, the more buy-in you get.
Yeah.
But for example, one of the things that I love, because we obviously won't necessarily see them unless it's taking out drain or that far later, then you'll get the opportunity, is the owner compliance for things like how often do you find owners go, my vet gave those anti-inflammatories, but he's fine, he doesn't need them anymore, I've stopped. And not understanding the importance of running the course, particularly antibiotics, if there's the requirement for it. So how often do you find that?
Quite often. We find that owners tend to misinterpret signs quite often. So they'll say, oh, well, it was hopping around on 3 legs and now it's, happy to chase monkeys. And and so they've stopped, the anti-inflammatories because the dog can't be in pain. But we're trying to educate them on the more subtle signs. So, respirate is a little bit increased. I actually had a patient the other day that I suggested they maybe speak to their vet about some pain control. He is a geriatric, so slightly different case, but I just noticed he tends to pant quite a lot. And initially I thought it was sort of a bit of stress thing coming into us, but I chatted to them. They say he does it quite a bit at home as well. And I thought, well, we can maybe chat to the vet, see if we can do an anti-inflammatory trial and improve it. If it does improve, then we know it's pain related and we can investigate that a bit further. So basic little things like that for even the post-op dogs, because they do often sort of, you'll have a dog that is improving, and the owner goes, oh, well, it's improving, so we don't have to carry on doing it, because it is a little bit sort of frustrating to add the 3 seconds to give it, the pill if you've got a good dog, or 10 minutes if you've got a difficult dog.
Yes.
So, we try to allow them to understand why, continuing with those pain meds is really important, because it's not necessarily just the pain aspect, it's the inflammation aspect. And if it's been, checked with the vets, completely different story. We're happy then, because then the vet's given the all clear. If not, we do try and encourage them to sort of hop back on the bandwagon and carry on with those meds as they've been prescribed. And in some cases, we actually will chat to the vets about, prescribing more.
Additional.
Yeah. Not necessarily stronger, but just potentially for a longer period of time to allow us to build muscle when we have atrophy and, muscle bulk issues. And it just, we want quality of life for the animals. So, we want to make sure that they aren't in pain and that they are living their best life, especially when you have invested all that money into quite an expensive exercise. Yeah.
So, I mean, we spoke about respiratory rate. What are some of the subtle signs that you encourage owners to look out for? Let's stick with our case, because I know that this can be very, very... So you're dealing with the case, post-op care, it's your special interest, although I know you do a lot more than that. They're on some anti-inflammatories, potentially they're going to complete the course because they understand the reason why. You've had the opportunity to explain. What are the kind of signs you say, look, you need to be reporting back if?
Sure. So generally, easy with the hind legs is he, used to walk up the stairs really easily, or used to jump onto the couch or into the car, and now isn't quite as happy to. Obviously, post-op, we're trying to limit that as much as possible. But you'll get, progression on that is, it looks like he's sort of using a lot of effort to get up. So he'll sit up, and then it sort of will chuck its head forward and shift that weight forward to get the bum up. And then sometimes you'll have a little bit of a limp. Sometimes they'll completely lift the leg and go non-weight bearing. So non-weight bearing we tend to find is quite a severe discomfort.
That's when it's red flag moments.
And especially if you have a dog that has been using the leg consistently, we sort of want to really investigate that and make sure that it doesn't need to go back to the vet for potential failure of the surgery or something like that. We also will have dogs that, when they're running, they'll start to use both back legs together.
A bunny hop.
So that's also one of the signs we'll see in like hip dogs that have hip dysplasia, or just general discomfort behind. They want to use the legs together as sort of like a pogo stick rather than individually. It just, in some cases when it's quite severe, you'll see the muscle loss. So fluffy dogs. Can
owners generally recognize that? Is that something that you teach the owners to? So do owners say, like, look, it's regained so much muscle mass here.
So it's one of our it's one of our objective measures. We'll often take a circumference measurement.
Okay, so you're actually manually measuring that.
Yeah, because it's very easy when you see the dog every day to go, is it, isn't it?
And photographs? How often do you photograph?
I encourage owners to, and I try and get them to do it sort of similar lighting, similar place, similar distance, so you've got as much as possible. It is something that, I probably should add, but time-wise and trying to get a dog to stay still isn't always the easiest. And I find the circumferential measurements
that tells you a lot.
Really good, what you tend to find really nice for more sort of our conditioning dogs, I suppose, but you'll start to see definition through the leg. So they start off looking a little bit like a chicken breast, and then you start to see actually, each individual muscle starts to get a little bit more definition. And it's nice because as much as we don't see them sort of infrequently, we see them infrequently enough that we can generally notice the difference because the owner's seeing it daily, and that makes it really difficult. You don't notice those small changes until they're big changes.
So how often do you get your patients fiddling with the wound itself? And what is your advice? I mean, obviously, not all of them have cones on. Not all of them. I don't even necessarily mean is that. I mean, is that a sign? Is that something you see often that they're bothered by that area, or do they tend to leave it well alone?
So that's something that we tend to potentially look at as a bit of a red flag. If especially like if they're chewing toes of that leg, because then we tend to think that it's associated with sensation, which then goes to nerves, and when nerves are involved, it's always a little bit difficult. And then, that's a red flag, chat to the vet, because we're worried. The wound itself, I find most of the time initially, they can be a little bit fussed with it, but once we sort of going 10 days plus, most of them, if everything's going to plan, is left alone.
So just in the interest, obviously, for the listeners who are very lucky that either the animals haven't had any laceration or incision or surgical procedure, that's generally the time frame post-op that we would talk about removing stitches. So 10 to 12 days generally. Some people are a bit conservative and say 12 days. And that's assuming that there is no underlying infection or massive inflammatory response. So that's the sort of time frame you are.
And that's sort of when we also will start looking at putting the dog in the treadmill, because the wound's healed and things like that, because we obviously don't want a wet wound.
No.
Which is easy when the rain is like it is.
Yeah, we've got KZN weather.
But it just, anytime the dog's paying excessive attention to an area that it hasn't before, coupled with a surgical site or something like that, it is a little bit of something that we want to pay attention to. You can also sometimes see like the hair will go a little bit different. In most cases, they're obviously shaved, so you don't notice it as much. But sometimes you'll notice just that coats change a little bit. Ideally, if they're shaved, you can see the skin. So sometimes there is a little bit of irritation. For the most part, I think that's generally managed quite well, unless you've got a dog that is a bit of an allergy dog. That makes it a bit more difficult. But, we chat to the owner and say, is this something you've noticed? Is the dog generally always lying on its left side when it's got an injury on the right? Or is it more inclined to, lie with its legs tucked up than it is to lie on its side? And does it choose to lie on the hard versus the soft? And most of the time it's actually just sort of pattern recognition, knowing what your dog's normal is so that we can know what its abnormal is. Because once we can establish what they normally do, we can say, okay, well, any change in behavior is something that we need to assess and possibly come back to the vet for.
Absolutely. So I want to take the opportunity while we're chatting, because everything, and I use the term holistic quite a bit, because it for me it embodies the whole, working from different angles and taking everything into consideration, not just anti-inflammatories or antibiotics or or putting the laser on. You are managing cases and case by case, but you're also discussing things like nutrition. And we all know the importance of nutrition because we can relate to it. We all eat, and we know that when we're eating well and we're doing a lot better. But we're also getting a better understanding now of the importance of a balanced diet, good, adequate protein intake. We know the impact of deficiencies on people. So are those the sort of things you support owners with as well? I mean, the supplementation, how extensive is the support that you provide owners?
So I mean, most of us have done the Hills VNA thing, so we do have a little bit of a sort of specifically to Hills. We've chatted to them, and we do nutrition. It is part of our degree, or course in my case. It's something that we tend to mostly refer back to the vet for, because generally they have a lot more knowledge in that area than we do. What we tend to help with is providing snacks. So owners like to give snacks, and it's really easy to overfeed your dog because you thought, oh, we'll just give it one of these or just two of those.
And particularly post-op.
Yeah.
Because
they're bored.
They're bored and they're recovering and you feel sorry for them.
Yeah.
And for
I think
owners,
half the time it's more difficult for the owners to have their dog cage rested than...
Yeah. So there's always the risk of them putting on weight during their recovery period because they're not active and they're getting more, like you say, snacks, treats. Snacks.
It's more, I think, from that perspective, we will try and give other enrichment so that the dog has that mental stimulation when it doesn't have the physical aspect and isn't getting all the calories that it should be getting when it's trying to.
So give us an example.
I know a lot of people are sort of familiar with lick mats and stuff like that now. Yeah. Those are really awesome. They work really, really well for dogs. If you've got a dog that likes to dig, I know a lot of people who will use something as simple as a towel. Everyone has one of those at home. And they'll put some of the dog's kibble in there, sort of wrap it up and tie it in a knot and get the dog to try and dig through that, which is just really simple. It gives them a lot of mental work and they were going to get that kibble anyway, so you're not adding to the calories that they shouldn't be adding to. It's also just understanding that because dogs metabolize things differently to us, just because we, could eat 4 of those and it wouldn't be a problem, it's not the same for the dogs necessarily. So the easiest way is to sort of meal prep. Take their kibble or their sort of ration for the day and remove from that rather than digging out, the full packet or in the fridge. Cheese and things like that is really easy to give. And if you are going to give that, because I know some dogs, are inclined to want that and it is difficult to say no when they're lying there in their cage looking sorry for themselves. Super easy, give them their snack and then remove a little bit of the kibble so that you're sort of creating a deficit again in what they would be.
So it's that balance between providing a good nutrition. I suppose on the other hand, you get, particularly post-op, some dogs that maybe don't want to eat so much. So or cats or penguins. So maybe you're having to support them nutritionally in terms of making sure that they get adequate support in order to repair. Yeah.
And that's also the thing, with the nutraceuticals and stuff like that, chatting to the vet and making sure that if we are going to add things like that in, there's no interactions with any medication the dog's on, because that's a really big thing that you need to, consider. And also just ideally getting the best quality food that the dog can be on is a big thing. I think a lot of people, you've spent a lot of money on, the surgery and investing in your dog. That's something it needs every day. And it is, unfortunately, we know dog food is expensive, but it's something that really makes a big difference, is a good quality. And it tends to mean that you don't need to add things like, this and that to make things better for the dog, because it's all balanced and it's all included in their diet. Because I think that's a big thing, is people like to add things. And when you're paying a lot of money for a dog food, all the research has gone into it to try and make it as balanced for the dog so that, it's getting the amount it needs for what it does. And then you chuck something on top of it and you throw that balance out, and then you've spent all that money sort of for nothing.
Absolutely. The thing is, we hope that we live long lives and we get to 80, 90, whatever, we're dealing with a shorter period of time. You don't want to reduce that. You don't want to reduce that lifespan. So everything that hopefully we're learning and we're gaining knowledge of going forward is all to aid increasing the amount of time that we get with our pets. Every pet owner, I think, will.
The worst part about
associate with that. That's the plan. So before I lose the opportunity, because I know that ultimately we're running out of time, I want to because we spoke about cruciates, and not all cruciates are due to animals being overweight, but let's say that is part of the factor. In order to avoid, so you have, again, I'm going to give you a case example because it's so much easier. You have this gorgeous lab. I don't know why it's always the Labrador. Shame. They're such nice dogs. Comes in. The vet's advised to go on a weight loss plan and referred them to you, because that's something you guys do really well. And so tell us about that program.
So the delightful thing about having an underwater treadmill is that you can increase the workload that a dog's doing without increasing the force on their legs, because that's a big consideration when you've got a potentially pathological dog.
Yes.
You don't want to increase that force going through their limbs. And so it's really, really nice because you can put the water as high as you want, get the dog to do quite a bit of work to help get that weight loss. You're helping build muscle, which is beneficial, and it's really controlled. We can control speed, we can control incline, decline, and it's completely flat. So, we don't have to worry about the dog suddenly standing in a hole or something like that,
or people throwing the ball.
Yes,
I know we made mention of that before, because that is easy. I mean, I'm like having a bull terrier. I go, I need to get some of this energy out of this dog, and what I do is I throw the ball.
Yeah,
because I'm busy. So I mean, you can say to people, like, we want you to walk around the block, dog on lead. It's very controlled. But people don't always have the time.
Yeah.
And I know it's just the reality. I don't think anybody should be made to feel bad when they're busy people.
No,
but
sure. Oh, the weather's
terrible. I know in the UK, just used to put on the rain jacket and stuff.
Yeah.
Us as South Africans, we're a bit more selective on the days like this. But this allows regular exercise that's non-weight bearing, and they enjoy it.
And it's indoor. We have a heater, so the water's nice and warm, which is a big thing, especially in winter. And I've had 2 or 3 patients now that I got told, no, they're terrified of water. They walk around a puddle. They won't go. They barely go out to toilets when it's raining. They'll never go on the treadmill, and we use food as bribery.
Wait a minute, we were just saying that.
So we'll either use food or toys, or sometimes the owner's enough, just to encourage them, and get them doing good work to move them in the right direction to improve their body condition score, because that's a really big thing, especially going back to the sort of prehab side of things. If you're going to be spending that much money on putting a dog through surgery, if you can get it going in the best physical condition it can,
it's going to heal faster.
Yeah, and it helps the vets. It's difficult. You don't want a super overweight dog.
Well, it's like increased anesthetic risk.
Yeah.
It's more cost in terms of anti-inflammatories and antibiotics. The medication is based on the weight of the animal. There's so many factors that are kind of relate to weight. So if you can get them in optimal weight, it's a win-win situation. You're setting them up on the road to recovery.
Yeah, and I think, also from a conditioning perspective, for our sort of non-surgical cases, had my biggest patient is 91 kgs.
Oh. And a horse, right?
I almost tried to use it as a bargaining chip to get us an underwater treadmill for the horses. So he was 91 kgs when he started coming to me. He has an awesome owner who's super religious, comes to me pretty much weekly, and he's gone up 5 kgs of muscle.
Wow.
So he's now 96 kgs.
Wow.
And he's just incredible. And
what breed?
Bobo.
Okay.
He's, really impressive is the only word to use to describe him. And it's really nice. Then on the opposite end of the spectrum, I've got a 2-point-something kg toy fox terrier. And for her, she's a little agility dog. She comes for conditioning because, her owner wants her to have a really good career and to do it for as long as she can. And so she comes also to build muscle. And she's put on a couple 100 grams, but it's,
in the right way.
Yeah, and that's the other thing is, why we use like the circumference as a tool, because just because the dog's put on sort of mass doesn't mean it's put on fat.
Yeah.
So we want to look at, body condition score, making sure that, we have a nice waist and all of that. Yeah. So that we don't go, the dog should be 32 kgs and it's 36. If it's 36,
because we often obviously we're very scientific about it. I can let myself down here, but if you've got a very overweight dog, you go, okay, I want you to lose, and then you use it as a proportional thing. I want you to lose 6, not you, we're never that rude to owners. We'd like the dog to lose 6 kgs, and then let's reassess. And that's that point of going, you don't want it to be unrealistic, because our advice is always you want to feed them for the weight you want them to be. And that's often, people go, but I'm not sure how to physically go about this. So increasing exercise, feeding them for the weight you want them to be, which means to actually take a look at the back of the packaging and feeding them for that weight, bearing in mind that many South African dogs sit behind the gate, mine included some days, and they're not exercised frequently. So I think it's really important. Own education is what you guys do really, really well.
Exactly, and it's being that sort of intermediary for the vets and the owners, so that if they have a question, they don't have to phone the practice and chat to the secretaries and then try and get the answer to come through, because the vets they've got a full day anyway. It's easy for them to they come and see me next week, they'll write down 3 questions that they have for me. If I have a question that I can't answer, then we can go through the vet.
And you've got good relationships with the vets that you work with, or even the nurses. I mean, they're really brilliant. So I mean,
but most of them are, what do I do? Because the vet said I have to lose 10 kgs for the dog, and how do we do that? So it's nice to say, okay, well, how many snacks do you give the dog? And they go, oh no, we give them 1 chew a day, but they also get all the scraps. So just little things like chatting to them about that, which does come out in conversation, rather than when you sit there and you ask them a question, they go,
definitely,
and they have to quickly think about everything they do. So it's just being a part of the team.
I love it. So obviously we are wanting to get more vets to understand the benefits of veterinary physiotherapy. We also want nurses to speak and collaborate more. But if owners want to get hold of you guys, there's a website, isn't there? There's a website. You're on social media. Which helps. So can they reach out?
Yeah,
where do they find you?
So we're on Instagram, Facebook. So under Equine Librium Veterinary Physiotherapy Clinics KZN for Facebook. Equine Librium KZN on Instagram. Our website is currently mostly geared towards the college, but it is being upgraded and all of that. Very exciting. And then we do have a clinic number as well. I don't know it off by heart, so I can't help you with that.
We can put all these details in our communication so that...
but pop us a message. Otherwise, you can email us on info@equine-librium.co.za. And any questions,
and be proactive. Be proactive, absolutely. And rather have a situation where you're saying, no, you're fine, you don't need it, which very rarely happens. But if people think that they may need you, it's best that they ask, because the worst you can do is say no, or I need to refer you to a vet, which
get you there earlier.
Just as important, and get them earlier.
I think the big thing also is bring the dog in, and if we don't need to see it, or unfortunately funds are a limiting factor, we can give you as much as sort of we can from a home perspective. Give exercises, give strengthening, give tips on how to help weight loss, and then give you a little bit of time to build up that buffer, so that if you do need to go to the vet, or you do need to sort of chat to them
and these are the signs that you really need to look out for. That will make it
100%
critical to see us before then. No, I love that. Thank you. We've got so much we could talk about. Obviously, time limited, but it's been really good to have you here today. Thank you, Paige.
Awesome. It's really exciting.
You're doing really good work, and people mustn't be fooled by the Equine Librium, despite, obviously, our listeners, also a lot of them are horse owners, but you do dogs, cats, even cats on the underwater treadmill I've seen. So
that's interesting.
Very interesting. But I hope we get the opportunity to speak again. And if our listeners have any questions, they can either reach out to you or to me, and we will happily answer them. So
absolutely.
Thank you again. Thank you for your time.
Thank you.
Thank you, Paige, for sharing your valuable insights into post-operative physiotherapy for our beloved pets. To all our listeners, if you have found this episode informative, be sure to subscribe to the Pause and Effect podcast for more in-depth discussions on all things pets. Don't forget to show your support by liking, sharing, and following me, Dr. Cara, as the Ultra Pet Vet on Instagram. Your engagement helps us bring you more fantastic content. Until next time, this is Dr. Cara signing off. And don't forget to give your pets a hug from me. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy am I itchy.
Are you on a hypo-allergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drcara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.